Welcome to the Pharmacists Are In, a podcast made for pharmacists by pharmacists. Pull up a seat and let's get started.
Welcome back to our live stream of the Pharmacists Are In podcast. My name is Ajit Johal, and look, no, we still don't see Dr. John Papastergiou. We're hoping he'll show up. He is on his way from Florida from the A4M conference, so hopefully he'll join us. But I am super excited for our next guests. We have Ian Patton and Lisa Schaffer from Obesity Canada. Welcome to our live stream at Pharmacy U.
Amazing. Thank you for having us.
Yeah, Thanks for having us.
Great. So let's start with, tell us a bit about yourself. I know we'll start with you, Lisa. We're practically neighbors in Vancouver, but quick, what is it that you do, and what do you think about Pharmacy U?
Amazing. So my name is Lisa Schaffer. I am the Executive Director of Obesity Canada, and I am so honored to have that role. I found the organization over 8 years ago through my own personal lived experience, but professionally I was a communications specialist and I worked at a digital marketing agency in Vancouver. And for the last 2 years I've been able to bring all of those skill sets over to Obesity Canada, which is an organization that's been around for 20 years. We developed the clinical practice guidelines for adults and pediatrics when it comes to obesity, and I'm just so passionate because we're in such an interesting moment to be able to have these conversations. And I think pharmacists play an amazing role in what is possible in transforming how people understand, support people living with obesity. So I'm super excited about Pharmacy U. This is my second one.
Fantastic. And I think there's a lunchtime panel on the topic. So for attendees, there's attendees who are live streaming. I see you. Be sure to attend the lunchtime panel. But you have to, because that's how you get lunch, right? So you have to see it. Fantastic. Ian, glad to have you.
Yeah, thanks for having me. I'm the Director of Advocacy and Public Engagement for Obesity Canada, and I started initially with the organization as a master's and PhD student when I was doing my obesity research, but also had my own lived experience. So I had bariatric surgery about 11 years ago now, and I had a turning point there where I kind of flipped away from my academic work that I was doing in obesity and leaned more into the patient advocacy side. And so I kind of bridged both sides of that fence, the lived experience and the academic research side of things.
That's fantastic. So I really love the lived experience portion, because our first live stream was with Bonnie, who's a cancer survivor, and she did a really good presentation this morning on sort of her story. How do you find, so as I'm a pharmacist, I'm a clinician, what are some key things that need to be imparted on clinicians about obesity, which is a chronic disease?
Absolutely.
Yes, I came prepared with that.
I was going to say, let's start there.
Yeah.
Number one, we need more people to recognize this as a chronic disease. Mm-hmm. And I love the moment that we're in, because I think the science and the solutions that are coming forward that will work for some, but maybe not all, give us an opportunity to create the space to have different conversations about what people understand about obesity, or misunderstand, quite frankly, about obesity. And one of the things that I think we often say, and it's the first chapter in our clinical practice guidelines, is about weight bias and stigma. Because you have to talk about weight bias and stigma before you can really even talk about treatment and the next step. Because we've got internalized bias, and we also know that we've got a lot of societal bias that might be informing how these conversations happen. So I think, Ian, you'd probably agree that that's where we really like to start with everybody, is like, let's recognize that this bias might exist and that we all have bias. And it's really about recognizing it and what we do about it afterwards. So that would be my thought on where we need to start.
Yeah, I mean, you said it, took it right out of my mouth. So I think we're in an interesting time right now where things have changed pretty dramatically in the space over the last several years. And I think the conversations that we're having are a lot more productive than what they were when I first got into this space. But there's still lots of work to be done. So there's still lots of members of our community who have that internalized bias, and they don't necessarily feel like they deserve or belong in accessing care and those sorts of things. So there's that barrier that we have to get over first. And then we also have to remember that a lot of them have had some pretty negative experiences in healthcare. So there's some relationship building that has to happen there before we can really get to effective obesity management.
Oh, that's great. So a couple things I want to talk about. The first one is you mentioned it's an exciting time in the space. So a couple things is not only is there a Pharmacy U lunchtime session, which is very well attended. Like I said, everyone needs to have lunch, so it's great that it's there, and it deserves to be there because it's very important. But also, I believe there was a summit recently.
Yeah.
I saw it posted on LinkedIn, and I saw such great sort of anecdotes from those who attended, and one of my actually good friends, Dr. Daniel Newey, he posted something about it. So I'd love to learn more about like what was the summit like, and is that something that's happening again?
Yeah, we do a summit every 2 years, typically, and then in the off years, we'll probably do a clinical update session. But I love our summit as well. This was the first one that I got to be kind of behind the curtain for the first time. And what's amazing about it is that we bring together researchers, the scientists, as well as the healthcare practitioners, and always the lived experience voice, because we know these things all need to come together. And again, it's this dynamic time right now when we're talking about obesity. And we know that pharmacotherapy is one of the 3 pillars that we can use for treatment. But what, again, is really exciting is that we're creating the space for these conversations, because it can get away from us really easily as well. And this is a moment that I think pharmacists, I'm talking to you especially.
You're listening. They're listening right now.
Because this is an opportunity where we need people to be able to have a relationship and not a transaction. And I love telemed. I think we've got a lot of innovations that we need to figure out together. But having a pharmacist that really leans in with you makes such a difference in people's lives. And this is that kind of moment where it can feel more like a relationship and someone who's investing in me because this is chronic. And I'm going to have to talk to you. Probably you and I are going to have a lot of conversations along the way. And it might not just be about my obesity, it might be about other things, because there are over 200 comorbidities that are attached to obesity. And we also know there's no NCD that doesn't benefit when we treat obesity. So helping people understand all of these parts is like so fascinating and exciting. And the summit let us have all of those conversations in these rooms together. The energy was amazing. And again, a lot of this, we have a lot to be Canadian proud about. We've got a lot of innovations that have come from Canada. We have Banting and Best was from us. Dan Drucker discovered the GLP-1 receptor here in Canada. Our clinical practice guidelines have been adapted and adopted by 8 other countries now at this point.
Wow.
And a lot of the thought leaders who have broken this mold of thinking about obesity differently have come from Canada. So I think this is a nation-building moment. Let's get more clinical trials into Canada. Let's be the people that show people how to do this right.
That's incredible. And one thing that came to my mind is this sort of integration of clinical and patient lived experience. Do you think, again, looking forward, that this is almost a watershed moment for a paradigm shift for any chronic disease or any condition should follow this model? What do you think, Ian?
Yeah, I mean, I was involved in the organization before we started incorporating that lived experience. So it wasn't until about 2015 at our conference where we had a panel that had that. And it was the first time at a scientific conference that I had seen that type of engagement where you had people with lived experience, talking about their story and their challenges and those sorts of things. And it was really, really powerful. And so that kind of was a watershed moment for Obesity Canada, where that all of a sudden became central to everything we do. Is I think it's a bit of our superpower, is having all these clinical experts and academics and researchers that are doing all these great things, but then centering it on that lived experience. And like from everything that we do, from our medical education to the advocacy work that we do, when we have those combinations, you center it on that lived experience and that real human story, and then you have that scientific expertise or clinical expertise coming in to kind of throw the 1-2 punch. It's really powerful, and it's made a big difference.
And I think in obesity, it's extra important because people have misunderstood or minimized what this is for so long for people living in bigger bodies or living with obesity, that, we need to take this moment and kind of put the faces and the stories to them. It's similar to the mental health, where mental health was maybe 15 years ago, before we had things like the Bell Let's Talk Day, and it felt okay. When I started volunteering with Obesity Canada, saying the word obesity kind of felt like knees and elbows coming out of my mouth, because it's not something that has been generally comfortable to talk about. So I think having the lived experience come forward and be like, no, I know I'm here. I know I deserve care and treatment and respect, and my story matters. And it also impacts genuinely how people have experienced care in life. So when you tie the two together, you can't deny the fact that having that lived experience voice is actually part of the treatment modality, is that you need to be able to like express your story and kind of process your own life, because there's been a lot of bias, not just in healthcare, in everyday life. I went to university. I paid a lot of money to go to university, but really didn't have a desk that was comfortable for me for, many years of my academic career. Those are also the things that we're talking about. So again, I see pharmacies as this amazing linchpin moment where people can talk about a lot of things. And if we can make pharmacies obesity safe spaces to talk about anything, and not necessarily just all about my weight, but a safe place that I can come and ask for help, we will make a big ding.
Definitely. No, that's fantastic. So speaking of the role of pharmacists, and one thing that's really been a great addition to the Pharmacy U education is not only having the sessions, but also the masterclass. And masterclass, I'm actually running my own masterclass with Carly and Alexa, and I'm big expert in the vaccine space.
Nice.
So we're doing one in June, but I took a look at the obesity masterclass. It was Dr. David Macklin, and it was also, there's a lived experience component.
Michelle McMillan.
Yes.
She is a co-host on our podcast as well.
Excellent.
If anybody wants to check into Scale Up Your Practice.
Scale Up Your Practice. We'll put a link in our show notes. Yeah. If you have a link, we'll get our producer to put it on there.
But yeah,
for sure.
I heard amazing things about that masterclass too. And like, how fantastic is it when you can dial into something like that, the energy in that room and the ability for people to share in real time in the words that they need to use to be able to move education and information forward is so fantastic. And I think that's something that Pharmacy U and the master classes have created in a really beautiful way.
Well, I think it shows, as pharmacists, we are just dealing with a lot of different things.
I don't know how you guys do it.
Yeah, it's a lot, but I think it's always good for those who actually want to carve out a niche clinical practice for themselves and to support patients and be that center of excellence. So I think master classes are great for identifying those who are motivated and then giving them the deep dive they need to have the knowledge and skills to do so. So I think that's fantastic.
So good. And we also offer education courses. I'm going to continue to pump our tires for a minute. So we have a pharmacotherapy course right now that's available that does actually offer your CME credits as well.
Oh, excellent.
And our conference was CSEP certified as well, or accredited. So we really are trying to make space for this, and we really want people to be able to meet this moment, because we know you guys are getting people walking in going, my friend is on this and I want it too, and I need to lose 20 pounds by whenever. So how many times we can help have that conversation and help empower you guys to help navigate the choices and navigate the complexity of dealing with somebody like me who might rock up to you and be like, hey, we need to talk. That's what we're really trying to do. We want to make it very real. And then we also have CBE designation, where people can be certified bariatric educators.
That's
much
fantastic.
Like CDEs.
Yes.
So
yes.
Again, I want you to be educated, and then I want you to tell the others. That is really our big moment.
That's fantastic. So the CBE educator, that's now official? There's a competency exam?
Yeah, we run the course twice a year. There's one that's coming up, so if you haven't registered, it's too late for that one. But in November, we will have another one. And we offer a course called Caliber as well that offers CME credits. We really want to just set everybody up in the front lines that is in this moment with us to have as much information as possible.
No, that's fantastic. Bit of a more of a clinical question. You kind of alluded to it earlier. What we do see a lot is that sort of word of mouth when patients are sort of on the right track with a good team of providers. Hopefully there's a pharmacist involved. They start to see results. What is a good way to set goals with therapy? I know it's a loaded question. Maybe just...
No, it's a beautiful question.
Yeah, what are the goals? Because often, people, this is just for anybody, we shouldn't just be looking at the scale.
100%. I'll let Ian answer this one because he's very involved in this side of the conversation.
Yeah, I get a little bit spicy about this one.
So. No, we like spicy, so let it rip.
No, I think most of the patients that are going to be coming to have the conversation, they are going to start at weight loss. They're going to have that initial weight loss goal because that's what society has told them that is important, and that's what they're going to have in their head. But we know that weight and BMI are not fantastic indicators for individual health. They're perfect and useful when we're talking about population stuff, but we need to go beyond weight and BMI for obesity management. So the targets for treatment need to be individualized. They need to be what's important to those individuals. And obesity can be very different from one person to the other, right? Like what contributed to my experience is going to be very different than Lisa's, and so what's going to work for me is going to be very different, or can be very different. But then our goals are also going to be different. So For me, it had a lot to do with physical function and my mental health and, my energy levels and those sorts of things. And so my vision of losing 100 pounds was really me wanting to be able to play with my kids and to be able to be active and do the things that I wanted to do and, get off my CPAP machine and all those sorts of things. Those are the treatment targets that we should be looking at for each individual person. And so coming up with those individual goals is, and kind of talking through what that weight goal actually means is an important part of that.
Yeah, I think often we chase numbers, right? But what you're referring to, I think, is like value-based goals, which I think are so much more impactful and so much more just better for everyone, for sure.
But it definitely takes a minute at least in my personal experience, it took a minute for me to be able to join you in that moment of seeing them as having value, because to Ian's point, it's the opposite of what we've been told for so long, to not focus on that scale number. And it's hard. And you need people like pharmacists that I'm going to see on repeat to keep reminding me that I am on track and I am taking care of myself and things are going well, no matter what that number looks like. Just the fact that you're staying engaged with care, quite frankly, can be a massive win unto itself. Just listening to Mike Boyvan's talk this morning and hearing how few people stay on obesity medications after 1 year when we know this is a chronic condition. That's a big part of the conversation as well. And we know access is another moment that deserves a whole lot of conversation. And that's what we really focus our advocacy efforts on right now as well, is helping people understand what it would really mean to make this a more accessible moment for people where pharmacotherapy is an option for them. Because innovation like that without access is just inequity, and it's cruel. And that's what we really want to see change.
That's such a powerful, powerful line. With regards to Obesity Canada, it sounds like you've made incredible strides and it's a really exciting time. What are some of your goals in the next 2 to 5 years?
Oh, we just set out on our 3-year strategic plan.
Oh, perfect.
You set me up perfectly, my
nice
friend.
segue.
It is. So we're really passionate about really changing the narrative is one of the anchor points. We want to be in as many spaces as possible to help people create the space to talk about obesity and talk about it correctly. We also want to shift systems. We know that we need things to change for you guys to even be able to execute practice correctly and bring the right standards of care forward. Our government is a delightful government. I'm so proud to be Canadian, but we do have some blind spots still, and we have a disconnect in a few places. And I believe our values, or our policies rather, are just our values on paper, and we have a few disconnects there. And then the third thing that we're also here, this is why we're here at Pharmacy U, we want to advance care. We want to get the education to as many people as possible, and that is for all kinds of allied health professionals. Our family docs are so important. We know that people are struggling to find care. How can we also help telemed be the right kind of telemed for people? So again, they're getting a relationship and not a transaction. And just really, all of that will serve to change this larger narrative so we can see obesity for what it is, so we can see people for who they are and get them back to work and back to the economy and back to their own selves, quite frankly.
It's fantastic.
So just a few small goals on our horizon right now.
Well, I think those are fantastic. And I think you have enough momentum to really set those targets for sure. Yeah.
We're excited.
Definitely. The other question I wanted to ask is, what role do employers play in all of this?
Well, that's another interesting question.
Do they play today, or what they should or could play?
Yeah.
Well, they play obviously an important role when it comes to, the benefits packages and the health packages that they offer their employees and those sorts of things. When it comes to access, that has been a huge barrier right now is, for people in our community, they don't have access to the treatments that are available. In our clinical practice guidelines, we talk about 3 pillars of obesity management. So there's bariatric surgery, there's pharmacotherapy, and there's psychological interventions. So bariatric surgery is obviously covered under our provincial health plans and those sorts of things, but access to it can take years, and depending on where you are in the country, it can be even longer than that, so that's difficult. Pharmacotherapy can be scaled up, but a lot of people don't have access to them through their plans. So a lot of the employers or the insurance plans have kind of categorized obesity treatments under lifestyle medications or lifestyle things. So they're an optional add-on to those insurance plans. So a lot of people don't have access to them there. And so for employers, they need to kind of hopefully catch up with where the science and the evidence is on obesity and start treating it like they do any other chronic disease, like we do with diabetes or hypertension and those sorts of things, and start including those treatments for the appropriate people, making sure that the right people are taking these treatments. It's not something that's going to be right for everyone, but making sure the right people are taking them. But opening those up and treating them like they are treatments for a chronic disease, which I think is really important. So,
yeah. And I think weight bias and stigma training in workplaces can go a long way as well for how much somebody can show up. So we don't have presenteeism, we have people genuinely adding value, and maybe getting some employers to think about their own policies and processes of things, of how they make hiring decisions. And there might be a tinge of bias involved in those. So just getting everybody to have the right conversations and think about things a little differently is a massive opportunity for us right now in Canada.
No, that's fantastic. I mean, I work in the vaccination space, so we're trying to work with employers to have vaccines as a standard benefit inclusion, and I think you're absolutely right. The GLP-1s should not just be dumped into lifestyle. That's a very ignorant way of looking at it.
Well, and they're not, right? For diabetes, they're covered under almost all the plans, right? And so I actually have members of our community, and this is one of the more sad things that happens more often than you'd like. But I have lots of people in our community who actually celebrate and get excited when they get a secondary diagnosis of diabetes, because now they can finally get access to this treatment that can work for them. So that's scary, and I think that's something we need to change.
Yeah,
and that's another moment.
Point.
Like, as someone who has been on medication for many years now as well, helping us realize that you're going to need to take this for a long time, like you would metformin. Like, we need to get rid of that pejorative mindset as well. Like, oh, you got your A1C under control? Great, let's take that insulin away, is not something anybody would say. But yet we still have to keep defending the right to access, even when we get the access, to say that we still need it. So there's a lot of opportunity to just help people just tweak the way that they're thinking about things, because I think when you say it, you can't unlearn it.
Yeah. Well, I like how you rephrased it. I'm looking at this and there's a lot of work that needs to be done, but you're saying there's a lot of opportunity. And it sounds like
the challenge is big, the opportunity is bigger.
No, that's great. You definitely have the right mindset. You're doing some fantastic work through Obesity Canada, and I'd love to link the podcast you guys have. Looking forward to the lunchtime panel. If you're listening on the live stream during lunchtime, it's an excellent presentation. And thank you so much for joining us on this podcast. Any last little pieces of information you want to mention before we close this episode?
Yeah, no, this has been such a great conversation. Really appreciate it. And invite everybody to check out obesitycanada.ca. You can find our clinical practice guidelines there. You can find other resources. And I will remind everybody as well, we are a national nonprofit and charity. So feel free to help us keep fighting the good fight and be able to develop these tools and resources in a way that is really conflict-free as well, and make it be all about the science, because the science needs to move forward so we can get the nation to move forward with us.
Fantastic. How about you, Ian?
Always leave it on Lisa's. No, I appreciate being in rooms like this, and whenever I'm presenting in front of health professionals, I always look at it as someone who represents the community. When I look out into a room and I see a bunch of health professionals, each one of them represents hundreds of my peers who are going to receive better care. So I appreciate people coming to these talks and being willing to learn and kind of advance their skills in obesity management, because it's really important to the people that I serve in our community. So.
Fantastic. Well, one observation on my sort of close, what I observed is you're both so passionate about the work you do. So keep up the great work, and I think with your passion, you'll hit all the goals that you've set and then some. But it's been a pleasure talking to you both, and please enjoy the rest of the conference. Thank you.
I look forward to seeing you around the neighborhood as well, sir.
Sounds good.
Thanks so much.
Okay.